I think more and more providers here in Wisconsin, specifically within my organization, Aurora Healthcare, we're adopting electronic prescribing as part of our ongoing use of an electronic medical record within an integrated healthcare system. And we're dealing with a large volume of providers that represent a very large proportion of the patients here in Wisconsin. And in our attempt to help patients live well and live more healthfully, I think the use of an electronic prescription plan simply dovetails with that overall healthcare picture or plan. I think you see the impact of electronic prescribing at multiple levels within our system. Certainly at the patient level, you see an impact in terms of convenience. You see a reduction in medication errors. You see an increased speed with which we can answer patients' requests for refills and start new prescriptions. So there's certainly a convenience and safety factor at the patient level. At the physician level, there's also a convenience. We have a more definitive record of what we've prescribed. We can certainly view any potential interactions or risk for polypharmacy that puts our patients at risk. And then certainly at the much larger scale, we see reduction in cost, both directly from the use of e-prescribing, but also indirectly when we see reductions in medication error and adverse outcomes. There is a secondary reduction in cost, both to the patient and to the clinic and to the third-party payers as well. They're in the exam room with me as I'm sending the prescription, and they can see how facile the process is, and to know that their prescription has been sent and that they don't have to drive to the pharmacy in inclement weather and wait for the pharmacist to make sure the count and the medication is correct. To them, it's rather magnificent, and as a physician, it's very gratifying to provide that service, and to know that I have a very concise and accurate record of what just transpired. It really has made the process much more simple. And I imagine the pharmacists don't have to scratch their heads looking at my penmanship either. If I do make an error in entering numbers, quantities, and so forth, it typically is picked up rather readily, and I do get some kind of communication afterwards as well. So the system may not be perfect, but in the pursuit of prescribing perfection, we really head toward excellence in that regard, and I think that's really what we're achieving with our patient experience.